We are now recording. This is going to be session number 5. Um, we only have 2 players at the table this evening. We have a Dr. Quinn Miles and Dr. Thomas Clausen. Both were present at last game, so we'll pick up their adventures where we left them. I believe Dr. Quinn had been sequestered inside one of the isolation rooms with Vincent after sustaining some pretty grievous wounds due to the defense system in this.
Where did that go off again?
We were threatening to.
I know.
Yeah, okay.
You convinced him to assault the precinct.
Yeah.
Yeah. So that didn't work out terribly well, and you guys went back to the room. I think, basically they opened up the door shortly after that for you. You're like, I have to go. They're like, okay, doctor.
And demonetized.
Yeah, they would have offered before you left. There's like a little, let's say it's like a bathroom with a shower set up and stuff. They're like, you probably want to get cleaned up. Like, I mean, you are bloodied and kind of fucked up. So they also have some like basic kind of clothing or whatever.
Oh, I have my extra clothes.
That's right. Did you come in your own van? I think you did, right?
That van's fucked.
No, I rode in the basically the SWAT team van or whatever it was.
Okay.
Armored personnel carrier.
So your own vehicle with all the kit in it is
No, I have the kit with me because I took it out to treat people on the scene, but there's kind of a guy stuck in my grill right now, so
that's right.
it might be a little weird driving around Boston with that.
No different than someone driving around with like a dead deer in the back of their truck in Vermont.
No, it's a little different.
I think fatal car accidents happen in Boston like every 5 minutes.
But driving around with the person still impaled?
The only part that's weird about it is that it's a Porsche that's an SUV.
That is pretty weird. Terrible decision. Shame on you, Porsche.
It's just like the South Park movie where they have all the black people strapped to the exterior of the tanks and stuff like that. It's just like most cars in Boston, just wrapped in minorities.
That's why the police are always going after them. And to protect their vehicles.
Right. Shock absorbers. I'm glad we recorded that. That was brilliant. So anyways.
And take 2. Today we have.
What about horrible racism? Okay. High or low? Whose adventure we start off with? Dr. Quinn shall be low. Hi,
How are you?
Dr. Clausen. You are, probably take a few minutes or whatever, shower, get yourself cleaned up. Put on your spare clothing before you leave the precinct. As you leave, you notice once you get to the elevator only goes to like 2 floors, this particular elevator, the parking garage, or to this level apparently. And, once you get out, there's a couple guards on either side, but they don't seem to, pay much attention to you as you leave from the parking deck. The attendant there did say he was going to get you an unmarked car, and so...
Taking my gear with me, just to be clear.
Very well. We'll say that it's like car 21 or whatever, and the keys are be put in it for you, so you can go. Should be gassed up. Certainly nothing extravagant. Probably, just like your typical...
An old Crown Vic or something.
Yeah, exactly. So yeah, where are you going?
Whatever that address was, northern Boston, to the Malkavian that's having the mental breakdown.
All right, that's right. Yeah, you drive.
Turn it on silent.
Sound effects. Perfect timing. Oh, must be they gave up. I think they're headed back to the fire department.
No, we're going down. That's another truck.
Oh shit.
Huh.
So
I
yeah,
was in an ambulance with him.
the you go
See
to
what's going on?
the address and just make Will drive us around in the new car that he sort of hates.
Sir, are you drunk? Yeah, but these two are way more drunk. Huh. And you came to a residence with cops at it to sit and stare at a fire that someone got injured at. Yeah, but these two are way more drunk. Okay. Why don't you go home?
You drive to northern Boston. It probably takes you, yeah, it is now like 3 o'clock-ish in the morning, I'd say. So, traffic's probably picking up just a little bit.
At 3 in the morning? Fuck living in a city.
Yeah, I mean, like, the only real downtime is probably between like 1 and 3 or something like that, really.
That's when the bars let out.
Well,
Not now, but
that's when it's quiet time. There's like the rest of the time, yeah. I mean, stores are getting deliveries and shit like that. Some restaurants are opening up. Well, not so much in COVID times, I guess. So yeah, it probably is pretty light traffic. Regardless, it's a 35-minute drive or so, and the address takes you to a sort of seedier looking part of town.
thought it was a warehouse I was going to.
Yeah, well, they described it as a warehouse. However, it's really more of like an automotive shop that now looks like it's probably not in business. It's just, sort of
Should have took my car. They could fix it while I was here.
run down, like warehouse section of town. And yeah, it's probably like some old, Gus's shop. And signs all rusted out and everything
Gus's
like
shop.
that. And there's a chain gate that looks like it's half fallen off, and but there's some parking inside through the gate. There does appear to be at least one car there that looks very out of place. In fact, it looks very upscale. Probably like a
It's a Honda Civic.
no, it's actually a Bugatti,
That's high end.
very high end. And yeah, that's all there is in here. Curiously.
Ah, a gift.
Don't mind if I do.
What are you doing?
I guess call Kwame.
You call, and the number. Well, it goes to voicemail initially. There is, however, a call that you get back fairly quickly, like a minute or so after you make the call.
Answer the phone.
Hey, who's this?
It's Dr. Clausen.
Oh,
Is this Kwame, like, by the voice?
yes.
Oh. I'm here, I think.
Oh, well, I'm not there anymore. I left a couple of associates there to watch over the individual.
Just in the shop?
Yeah, the shop there. Yeah, Gus's place or whatever. One of them should have a car there or whatever. Just go in the side door and tell them I sent you.
All right.
You want to go inside?
Yep.
Yeah. As you enter this shop,
You get shot.
you are.
Get a text back from Kwame. Shit. Like, don't open the.
Should actually try running a game instead of stuff in my face.
Yeah, tomato.
Okay. Up here. As you enter the
I
shop,
will take over.
you go right into the bank. This being the back of the shop. And fairly spacious place, probably like a
Did I ever learn this guy's name?
yes. Yes, actually, it was stated at some point in the past.
Go through your pages of notes.
Yeah, that's the problem. I'd have to check my notes there.
Jordan Washington. Mulcahy that won the lottery went crazy.
Yes,
Jordan
yes.
Washington. No relation.
And yeah, in the bay, pretty much almost like as soon as you go in, maybe 20 feet from the door, you see it looks like there's a like plastic, one of those portable tables has been set up, and there's a couple individuals that are like on their computers. They seem to be working away, and just beyond them, probably 10 or 15 feet or so, is a what looks to be like a mummified person. It like actually strapped on into, well, it would be on the exterior of an old car that happens to be in there.
Oh, I walk up to the two guys on the computers, I guess. And evening, gentlemen. Dr. Clausen, Kwame sent me. Point over to the guy strapped to the hood. Jordan, I presume?
Yeah, they both sort of look at you and look at each other, and one of them immediately goes back to typing something, and the other one says, "Oh yeah, that's Jordan back there."
Okay. Not really. What's going on with him?
Kwame just called us in here to like babysit, I guess. Jordan here, they like found him somehow wandering around, and he's been very insistent that he doesn't like want to go with anybody or didn't seem to know anybody. Just seemed not himself, I guess. But anyways, he was burning blood and may have put himself into frenzy. So we kind of like just strapped him down some more to make sure he wouldn't go anywhere. But yeah, not really sure what's like wrong with him. I don't think there was anything physically wrong. I mean, as you look over now, you can see that like he's literally wrapped in like old chains, and there's probably like his whole body is duct taped. At this point, there's like some like muffled stirring and some growling and stuff.
Is his mouth covered?
Yes, like the whole head, like everything's just duct taped over. They're like, yeah, he was trying to dominate people, and they just didn't know what to do with him. And eventually, I guess it just burned his way into frenzy through, using up blood.
That is the only way to deal with a Mulcahy.
Okay. I'm gonna need the assistance of one of you.
Oh gosh, we're both really busy here.
Which one of the two looks stronger?
The one that's probably both of these, I should say, are like they look like they're tweens.
Oh, perfect. The assistance of both of you. Temporarily.
They're like, oh gosh, all right, like, yeah, they don't seem like super keen onto the whole situation or whatever. Both of them just have their heads buried into their computers, but they do get up and agree to assist you. Like, what are we doing?
Well, first I'm gonna like set up an IV into him, and
Cocaine, liquid
Yeah.
cocaine.
then basically their only job is to hold his head very, very still while I take a scalpel and cut open the slit over his mouth and like little holes over his ears. So no eye-to-eye contact, leaving that covered, but that way he can speak and hear. And when he comes out of frenzy, then maybe I can figure out what's going on.
Very well.
And once that's done, like you can go back to your typing or whatever.
Yeah, roll me a medicine and intelligence.
By 15.
Yeah. It is definitely a very strange situation as you're trying to work through layers of rope and tape and chains and everything and get an injection site onto him that you're like, this will hopefully do something. and
I don't suppose they have any blood here, do they?
no.
Oh, looks like I'm using mine. Come on. 6 left. No.
So yeah, you get some blood into this guy, and yeah, it doesn't seem to have much effect. The blood definitely gets taken up and stuff, but you don't know what deficit he was working off of. He might need to go to full to like come out of it.
Why don't you keep pumping blood into him?
All right.
Because if he's frenzied, there's nothing I can do on him.
Yeah.
How many does that take? Unless it's more than 6, in which case I'm just fucked.
Yeah. Unfortunately, it takes like you go through 6, and he's still taking blood in. I mean, you know, even 13s and stuff usually are like mid-30s or so for blood capacity.
You still got blood in you.
6 bags of blood? And he's not good anymore?
No, I thought
mean,
we'd established that you have
that
to be fed up.
Yeah, that wouldn't. If he was going from 0, that wouldn't put me at max. You know.
Do I know what gen this guy is?
None of the 2 that you're working with have any real idea. Like, what do we think you might be?
Oh, it's only 5 points per blood bag, isn't it?
Yeah. You might be getting close, especially if he's a higher gen. But you're probably just not there.
Is there a place around here where I can buy more blood?
Yeah. You could go to one of the established clinics and purchase some more. Or, of course, do Bluebird.
How long does it take to get to the clinic and back?
Probably take you, I'm guessing. Yeah, not too long. Maybe 40 minutes or something like that. There's probably one in North Boston that you can go to that's not terribly inconvenient.
All right. Tell the guys I need to get more supplies. Whose car is that out there?
One of them raises his hand.
Mind if I borrow it?
I can drive you. I don't know if you'll be able to handle it.
Fair enough. No, I'll just drive myself. So I just want to drive a fancy car. Nice choice, by the way. Yeah, I'm gonna go get more supplies. Try not to die while I'm gone.
Yeah.
Okay.
Cool. The drive is not too bad. You're able to go to the clinic and basically, present your medical information and stuff and get some blood and come on back and just going to continue to fuel them up.
I'm getting 10 more.
All right. So yeah,
Just keep pumping it into him.
he ends up taking another 4 bags.
Convenient. Got 6 left. Just where I started.
Before the shaking seems to stop.
Jordan, you in there?
Who's that? Who's talking?
My name is Dr. Clausen. Kwame sent me. Looks like you worked yourself up into frenzy somehow. Can you tell me what happened? What's going on?
I was on the street. These people, they grabbed me.
Oh,
I tried to fight.
calm down. You're safe now. Just deep breath. Kind of then pause for a second. It's like, shit, we're vampires now. Anyway, just calm. Take your time.
Why can't I see anything? Where am I?
All right, I'm gonna remove the tape from over your eyes. Apparently, you tried dominating a few people.
Did I? Okay.
And just kind of, is it just tape over his head or like what's going on?
Yeah, it's literally like someone just duct taped over his head. Yeah. It's like, his hair is sticking through in spots and everything. It's like someone did a real bang up job.
Okay, I'm gonna
Malkavian medical care is somewhat.
I'm gonna unwrap to the
primitive.
point where I get down to the bottom layer, and then I'm gonna tell him to stay very still and cut it out because that would suck just having your hair ripped out of your skull. So I don't really want to do that to him.
Yeah. He as you're doing this, you hear him just talking to himself constantly.
What is he saying?
he seems to be having like a conversation with someone, and he's talking really kind of nonsense. It's
While,
not
while
even
he's
like
when I realize he's talking or start like having a nonsense conversation, take out my phone and just like start recording. I mean, it's gonna be a video, but just because you can't do just audio, but just set it down on the table or something
all right.
in case I need to reference that.
Yeah.
You can do just audio on an iPhone.
Can you?
Yeah.
Oh.
Yeah.
What do I know? I'll do that then.
Very well. Take your cell phone out, start putting it on audio recording, and yeah, as I mentioned, like he seems to be like giving names of people, and it's like he's talking to multiple people. Honestly, jumping between different like conversations, and almost immediately seems to like just lose awareness of where he is. Like it sounds like at one minute maybe he's in a club or something like because he's like really loud and talking to someone in a sort of friendly way, but just he's all over the place.
What are the chances in my bag I'd have some like schizophrenia drugs?
You definitely
I think
have
it-
some sedatives, but yeah, I mean like, but yeah, like a schizophrenia drug probably would like take a while to administer and like bring someone down. But yeah, we'll say that you probably have some. Like I know there are some like psychological sedatives and stuff like that that'll knock people down. Klonopin, yeah, stuff like that. Yeah. Yeah. Roll me a die, and if it's above, we'll say 10.
It's 12.
Yeah, you have some Klonopin in there.
Okay, I'll give him whatever a small dose of that is.
All of it. All of the K-pins.
Oh,
Take
God.
that, Malkavian. Now you're a Bruja.
Yeah, he does seem to calm down a bit shortly after you administer that medication. We'll say that you probably do that after, or maybe just before you remove the eye covering. And yeah, he definitely like seems out of maybe do like an eye check type thing and stuff, and like his pupils are super dilated, even though he's got like, he's got light in his eyes and stuff like that. Normally they should shrink down.
So is he drugged up on something right now other than what I gave him, or
Without a only an intelligence medicine.
medicine as in that medicine, or medicine like education experience medicine?
Oh, do the education experience one. That would be a good one to use for that.
I passed.
Yeah, it could
By
be
how
a 20.
much?
Could
Keeping
be
it.
a 20.
By 16.
Yeah. You are
Right side of being min-maxed.
even with that roll, like the symptoms, as best you can tell, like looking at like the eyes and stuff like that. You're like he could have drugs in his system. Who knows how long they've had him? Like maybe he was high when they picked him up, and God knows what he could have in his system without a drug test or something. It'd be hard to tell. So you think there might be some of that going on, but you're also pretty sure too that there's a definite psychological element as well. To clearly he's like in some sort of like manic or schizophrenic phase. You're thinking that's definitely, and whether the question though is like he's so far gone that whether he's actually experiencing an episode of what you would presume would be his normal thing, or you're sensing that like maybe something was like done to him discipline wise.
Intelligence and knowledge. Try to get an idea of like what disciplines could do something like this.
Sure. I'd say you could use an education experience and vamp knowledge on this one.
Over by 4.
Yeah, you've heard, maybe even encountered perhaps in the past, someone who had been the victim of a Sabbat Malkavian or Malkavian anti-tribute, and the dementation, which is basically the ability to make someone else temporarily crazy. So,
Temporary though, I like that word.
well, as far as you know, it can like last months or some cases like years. Like it will last a while typically. Um, and yeah, there's no real way that you know of to remove it. But yeah, combined with whatever craziness he had in the first place, like, and drugs, like this guy's might need some time to be salvageable.
Yeah, I guess I'll just start. If he's still with it, asking him to explain like who grabbed him, where he was, like, what happened, like the last things he remembers.
He seems to be going through, like, after the drugs, fortunately, he's like talking slower, and it's almost like reasonably understandable. He, like, seems to acknowledge you for a bit and says, I was on Jefferson Street, which you would probably recognize as, like, a street in Boston or something like that. We were like, I kind of, hoping to go back further than that. And he does, though, mention at some point, gosh, what is the, God, can't think of the name right now. Capital of Pennsylvania there.
Pittsburgh?
Philly,
Philly, no.
Philadelphia, Pennsylvania.
Is
sorry.
Philly the capital?
I don't think it is the capital. No,
It's,
I think it's Harrison or Harrisburg is the
Harrisburg
capital.
is the capital, yeah.
Yeah. I was thinking of Philadelphia. That's where he was last.
Yep.
That's
And
where he's talking about the Jefferson Street.
You're not sure. You know there's a Jefferson Street in Boston, but there could be one in Philadelphia.
Oh, I
too.
didn't know
Who
if he
knows?
said like he was in Philly.
The original request that you got from Kwame was that this guy had apparently been on some job in Philadelphia, and he was supposed to like bring back some information apparently, and never kind of reported in. So you're like, well, logic would dictate that maybe he ran into an anti-Trabuc Mokavian there and got more than he
Philly
bargained
a
for.
Sabat or
Philly's a Sabat city.
I'm gonna just keep listening to the story, and then when he's eventually done, call.
He does say something though. Roll me another. This would be your contacts, I would say, and vamp knowledge.
Contacts and vamp knowledge.
Mm-hmm.
You're really fucking me on this one. Not one.
What?
Not one.
And that one? He mentions something that sort of catches your ear a couple times and just like ranting. He mentions the wolf. The wolf is coming. And you recognize that somehow. Perhaps you've like worked some other job or something like that in the past. Where this like topic came up. But the wolf is a like semi-notorious Sabat who tends to like operate around New England. Beyond details, like what it looks like or anything,
Do
you
I
don't know.
plan any of that stuff or no?
No, you've just like heard that there's like this really bad Sabat known as the Wolf, who will I guess he's known to come around into cities and cause problems, and then will go away and seemingly plague some other place.
All right.
But yeah, anything less than one wouldn't you wouldn't know that name.
I had to roll under an 8, so I guess once he's kind of settling down and done rambling, call Kwame.
All right. Yeah, Kwame answers the phone this time directly as you call him.
Kwame, Dr. Clausen. After speaking with Jordan as much as I could, I'll tell him like I think someone used the dementation on him, so temporarily, that word being used loosely, insane. The only real relevant bit I got out of him, he said the wolf is coming. I guess it's some big bad Sabat, I guess. But other than that, he talked about being on Jefferson Street. Couldn't really tell where. Like, that could be in any city. Presumably Philly, because that's where he was, but could have been when you guys picked him up here. I mean, there isn't really much I can do for him, short of like just talking to him. Like, I don't know if there's any high abilities that can remove that, but it's nothing I'm capable of doing.
Yeah.
You guys want pizza?
Hmm?
Pizza?
Yeah, for pizza.
Toppings?
Slice.
Mushrooms.
I don't give a fuck.
Nice.
He says, yeah, I might know a guy, actually. Got introduced to him just recently. Salubri.
Oh. What the fuck was it?
Thaddeus. Thaddeus?
No, there it is.
Yeah.
Deathius?
No, I don't think that was his name.
No. Oh, interesting.
But yeah, he might be able to help him out, I guess.
Yeah, it's worth
I
a shot.
understand he can cure that sort of stuff.
Yeah, if you want to give him a call, I mean, there's not much I can do psychologically for him, but I can stay here with him and keep feeding him blood if necessary, or help talk him through anything until your friend gets here.
Yeah, if you could do that, that'd be good. Just someone to help out the twins there. I mean, that would be very handy. I don't know if we'll be able to get him tonight, though.
Oh, I was expecting to spend the day here anyway.
If you could, that'd be appreciated. I'll give him a call. Have him try to come over tomorrow evening, first thing.
That sounds like a plan.
All right, thanks.
Have a good one.
So yeah, we'll leave you off there, and we'll now go to Dr. Quinn.
Give me a second. Pass me that wallet over there.
Oh God. Go back to Thomas Clausen. Are you doing anything after that call other than kind of sitting around and trying to talk to the guy, or are you pretty much just recording his rants at this point? Like,
Well, I'm still recording him, but anytime he seems like he's more with it and not lucid, I'll talk to him and not even really necessarily trying to pry information out of him, but just reassure him like, all right, like, you're safe here. Don't worry. Like, we got someone coming that's going to help you out.
Yeah, you can tell like he's sedated at this point certainly, and that's probably helping. But he is getting like hostile at some points, and you like sense maybe that even he's like burning blood and trying to use like potence or perhaps celerity. Like he may not even be in like control of it. Like he's just so far gone at this point.
Oh, he's still strapped down.
Yeah. Your only concern would be like, oh, Jesus, I don't know how much blood I might have to, if he goes down to zero again, basically. Like he sort of got like a little timer on him. And
What happens if a vampire goes down to zero, goes into frenzy, and doesn't get any blood?
Torpor.
they will cease to exist pretty quickly.
They'll die.
Yeah. So, like, actually, no, they do go into torpor.
Yeah,
That's
they go into
correct.
blood. They go into blood torpor rather than like.
And then you can come out of that by just pumping blood into them.
Yeah.
No, I think that's the one where your humanity plays a factor.
Yes.
Okay. I was gonna say if they die, I'm gonna have to go back to that clinic and say, like, give me a case of blood.
Yeah. So that's correct. That's in the way we're using the system currently. If you lose all your blood, then you're in the blood torpor, and you would have to get someone of lower gen to feed you, basically, to bring you out, unless you wait the umpteen amount of time that, depending upon your humanity. it would take. The stake, as we discussed in the last one, is more like a temporary paralyzation now, rather than a torpor type situation.
Yeah.
So, I mean, you could stake him too. Like that would at least like pause him essentially, and remove the stake presumably, and he could come back to whatever state he is. But yeah, that may be an option to consider as well.
Could I get to his heart without removing a whole bunch of restraints?
Presumably,
Can they be like moved?
yeah. I mean, it's gonna be a little weird. You might have to look for a little while to find a good like route, but it can be done.
All right. When it gets close to daytime, I'll wait till he's kind of more out of it. Then I'll stake him, kind of duct tape it down in place, essentially, and that way, come nightfall, I can hook an IV up, remove it, and hopefully get him back up to full by the time whatever the guy's name comes.
All right. Very good. Yeah, we'll say that you probably have to spend a little time, looking around. Maybe you find like an old broom handle or something like that. Create yourself a little stake that'll do the job. And yeah, you're probably gonna have to like enter in from low and like kind of find a good angle, pop the heart in. But yeah, let's go to Dr. Quinn.
I mean, I think the entirety of this evening will just be tending to Vincent's wounds with the biothaumaturgy, and just kind of waiting for us to be released, for him to be released, I should say. That's really about it.
Yeah,
I don't think we've seen the last of this Abaddon City, so I kind of want to be with him for a little while. Like, I want to make sure that someone's always with him. Whitey's out of town, and I know that. I mean, I think we have to keep this house now because I'm staying there, but maybe not. We'll basically just keep track of Vincent, make sure he doesn't get fucked up.
All right.
Wait for him to either sober up and get released, or stay with him for the rest of the night, essentially.
Yeah, this is tricky. Like, you are able to, use the rituals of biothaumaturgy. As you said, they apparently don't take blood directly to use, which is fortunate. But normally, like, when you do use them...
It's not necessarily on his arm, it's just about the burn wounds that happened last session.
Well, that's just it. Like, you guys are both burnt probably over, like, a good 80% of your body, which now have, like, aggravated damage. So, it's going to be difficult. Like, you're actually in a tougher situation than you may think, because you are like hemorrhaging blood yourself because of these aggravated wounds. And there's like damage to your digits, and like who knows if you can even see right now. Your eyelids might be, because it's just like everything's been burned. Your flesh and the clothing and stuff has been taken off. Like, as you guys were, you're able to walk in without too much trouble, but it could be challenging to extricate yourself from the situation alone.
Right. I mean,
so roll me a discipline check to try and use your biothaumaturgy to. We'll say, are you going to focus on yourself or focus on Vincent here?
Myself first. But I think I actually stated last game that I was kind of doing both at once, though. Basically, do kind of like with one hand doing this portion of my fucking head, and then with the other doing, going over his injuries. So do you want, is it intelligence? It's intelligence, right?
Yeah, I think it's intelligence and endurance, yeah, for a discipline check.
Oh, intelligence and endurance.
Or stamina, sorry.
Stamina, and so we don't really the check score itself, or the discipline score itself, rather.
Yeah, we don't roll that.
Okay.
It's just
intelligence and stamina.
Mm-hmm.
Under by 9.
Very good. Yeah. It is honestly very close. Like, the blood supply in here is limited. Fortunately, you do also have regeneration.
Yeah.
Vincent's sort of SOL in that like he doesn't have great like regenerative capacity, but you're like, all right, like your first issue is just like your hands, which were like burnt to the point you couldn't use them.
Yeah.
And so you focus on that. You're able to get your hands, non-aggravated damage and regenerate them to the point that you have some mobility, and you are certainly burning a little bit of blood in there, but it's fairly efficient. And fortunately, they do also have some available.
Yeah.
You do actually run out of blood at one point in this process, trying to get yourself, fixed up and stabilized along with Vincent. And, I don't know if you'd request from them for more
Yeah.
blood.
I mean, we're not. At least I'm not like a prisoner here, so.
Yeah, the guy says, yeah, we can get you some more blood. It just take a while. And this is probably like 4:30ish or something like that in the morning as you've been working away.
Okay.
And yeah, eventually you are able to stabilize both yourself and Vincent. It is, however, probably now getting more towards morning, and you can start to like feel the fatigue setting in.
Yeah.
Like, oh boy, I need to go to sleep soon. And both of you are kind of like, I'd say, at least maybe a quarter blood right now.
Okay.
Having been topped off and stuff, and you're like, wow, we're probably both going to be pretty hungry in the morning unless we get some more blood here soon.
Yeah. What max change? Round up or round down?
Round up.
Huh?
Round up.
Round up. Okay.
Round up.
How much do you? How much do you burn just in a night without doing anything?
2, 1,
It's 5.
5. Okay.
Yeah, so basically a pint of blood to just break even. So most vampires could, go maybe 7 before they're gonna frenzy. It last about a week. The more senior vampires will last longer, obviously having a bigger blood pool. However, they do get a certain need in some cases for actually, like vampire blood or ghoul blood. Like it can get very specific for the more powerful ones. So yeah, as I said, that pretty much takes your evening to work on that. And yeah, they do offer. Maybe the most disgusting thing too, as I said, you're both horrendously burnt, and like your hair is burnt, like just the smell is awful.
Oh, yeah.
Fortunately, your sense of smell probably got burned off with most of your nose, but once that like gets regenerated back, you're like, oh god, this is awful. And that like you're just nasty and smell awful, and like there's a crust on your skin, and same with Vincent.
You went to med school. That's what he affects at this point. It's like, yeah, it's a body. It's fucked up. It is what it is.
Yeah, you're like, oh boy, I know what those people that I melted earlier feel like now. Oh, this is great.
A little bit. I mean, let's have some empathy here.
Yeah, for sure. There's definitely a lot of pain. It is certainly a traumatic experience, like just going through this in a way, having to try to heal yourself and Vincent through this. You've not necessarily being a practicing physician probably ever dealt with anyone burned over this extent of their body.
It depends on. Well, I mean, I had envisioned that the sect of the company I was working for was purely off the books and doing like experimental stuff. So I would be surprised if I hadn't seen burn victims before, especially with like being a vampire. But I think the main component for me that's like probably mentally staggering is just the fact that it's on me, not someone else. That's because I don't think the gym, like I don't think Vincent's burns affect him as much as it is like, oh, this is. It's not like the angles. It's like the actual like mental like it's the knowledge like the you are now affected. Like you have been in a combat. You have fought for your life, so to speak. I think it's a culmination of both the procedure and also like what happened to him to get here.
Yeah.
So at least that's how I envision. At least there's a lot of probably more. There's just some nuances to it with this fucking sociopath I'm playing.
Yeah, the other thing you notice too is that Vincent also doesn't seem to take as much blood to get back to his full. You're probably aware with your medicine score as well that in this system, like your limbs do actually contain some of your blood. So like
Okay.
his max is now reduced as
Yeah.
long as he's missing those limbs.
Okay.
You know, of course, they will grow back probably in a couple weeks unless he continues to melt off any new growth. Um, But the people that are there, as you sort of wrap up, as I said, just probably, you know, it's like maybe 5:30. You're like
Yep.
feeling the pull goes about ready. They're like, well, if you know, we got some showers in there if you want to just kind of clean yourself up before you know you go to sleep.
Now, if we open these doors, he'll probably run out. It's fine.
All right.
If he's not sober yet, at least. But
You want us to like get you a set of clothes or something like that for tomorrow? Like anything in particular? Like, presume you guys are gonna want to clean yourselves up and
no. But if you could,
you're.
I'm gonna write down a number on a piece of paper or whatever the fuck is available in this room. I imagine there's something. Write down a number and say, call someone and have her arrive. Like just let her know that I'm here and I'd like to arrange transport for myself and Vincent when the time comes, and it'd be nice to have her presence here.
Sure.
Anastasia's number.
Do either of you have a vehicle? Was a vehicle left at
She'll
the?
drive here and we'll drive out.
Oh, okay. Yeah. Did you drove your car to?
Yeah,
this
she has her own
meeting?
car though.
Oh, she does. Okay.
It's some. I remember what game it was, but I remember her saying like I remember specifying she had some like my car variant of whatever you'd find in Boston, just like something that runs. That's all
Yeah.
that matters. It
Yeah.
doesn't, you know.
It's a Subaru.
It might be. It's Boston. It might as well be. Yeah,
It's
honestly.
fine.
I don't want you getting hurt, Anastasia. You need all-wheel drive.
All-wheel drive and an excellent safety record. Very well. We'll say that you both go to sleep for the evening or morning,
Mhm.
and have come to some resolution. Things seem to be stabilized,
Right.
and we'll call it there and have a break here.
All right. Let's pick up.